Hello, everyone. So this is a small talk on the importance of breast screening and mammogram. What is the aim of breast screening? Screening aims to find breast cancers early when they have the best chance of being successfully treated. And to have screening, you have an X-ray of your breast, which is known as a mammogram. This is usually done between the ages of 50 and 70. And after the mammogram, you should get a letter with your results within 2 to 3 weeks. This will tell you what you need to do next. What is breast screening? It involves testing apparently healthy people for early signs of cancer. And the breast screening uses a test which is known as mammography, which involves taking x rays of the breasts. Screening can help to find breast cancers early when they are too small to see or feel, and these cancers are usually easier to treat than larger ones. It is important to remember that screening will not prevent you from getting breast cancer, but aims to find early breast cancers. Who should have breast screening? So, as per the NHS UK breast screening program, all the women between the age of 50 to 70 years should have breast screening, and it is done every 3 years. What if you are younger than 50 years? So, in that case, your risk of breast cancer is generally very low. Mammograms are more difficult to read in younger women because the breast tissue is denser. So, the patterns on the mammogram don't show up as well. There is little evidence to show that regular mammograms for women below the screening age, that is below the age of 50, would reduce deaths from breast cancer. So the ideal age for breast cancer screening is between the age of 50 to 70 years. Given that there is no family history of breast cancer, like the woman's mother don't have history of breast cancer, or sister doesn't have any history of breast cancer, and it is done at interval of 3 years. How is the breast screening done? So the breast screening takes 2 x-rays of each breast, and this is done by the mammograms, in which x-rays are taken, and this is done by the specialized radiographers. You have one mammogram from above and one from the side on each breast. It may be uncomfortable and sometimes painful for some people. What happens after the breast screening? So you will get your results within 2 to 3 weeks, and most people have a normal result. If you have a normal result, then you will receive a letter to let you know your mammogram does not show any signs of cancer, and your next screening appointment will be in 3 years' time. What if the results are not clear or shows any abnormal areas? Then the clinical staff will call you back for more tests, and you might need to have the x-rays taken again, and you will be having the mammogram done again. And if there is any abnormal area, in that case, some samples will be taken from that abnormal area, which is known as the biopsy. What are the possible benefits of breast screening? So, breast cancers found by screening are generally at an early stage, and very early breast cancers are usually easier to treat, may need less treatment, and are more likely to be successfully treated. What are the risks of breast screening? Although breast screening can find many cancers early, it is not perfect. There are some risks, and some people may have a false positive or false negative result. False positive result means that there is no abnormality in the breast, but mammogram is showing that there is abnormality. What is the false negative result? It means that there is some abnormality and the mammogram has missed that. What about exposure to radiation? Each mammogram exposes a person to small amounts of radiation from the x-rays, but the amount of radiation is very small. In fact, it is negligible. Now, let's talk about screening for women at higher risk. So, in that case, you can have screening from a younger age if you have a higher than average risk of breast cancer. This might be due to the family history, that is, if there is history of your mother having the breast cancer, or your sister having the breast cancer, or your aunt having breast cancer, or an inherited faulty gene. However, it is very important to remember that not everyone with a family history of cancer is at increased risk themselves. If you have a family history of breast cancer, then you should start having screening mammograms every year in your 40s. So the screening mammograms needs to be done early. If you are younger than 40 and have an increased risk of breast cancer, you should be offered yearly MRI scans, that is the specialized scans of the breast from the age of 30 or 40. So, where you are at high risk of having the breast cancer because of the family history, in that case, you will be having mammograms every year or even the MRI scans every year. And this will depend upon your level of risk. If there is a faulty gene or gene mutation, in that case, you will be having yearly MRI scans from the age of 20 or age of 30, depending upon the type of faulty gene. Now, it is also important to know that if you are having mammograms every 3 years, it is important to make sure that you know how your breasts normally look and feel. Cancers can develop between mammograms, and this is known as interval cancer. Mammograms can also miss some cancers. If you notice any unusual changes in your breast, don't wait until your next mammogram. See your clinician straight away. I hope this was helpful. Thanks for listening. Thank you.